Good afternoon and welcome to our webinar. My name is Debbie Honoroff with Hofstra Continuing Education, and I am going to turn the presentation right over to Tommy Maestas from CareerStep. Tommy, take it away.
Thanks, Debbie. This is Tommy with CareerStep. We are an online career training provider based in Provo, Utah, and we partner with colleges and universities throughout the country to provide our online allied healthcare job training programs. And I'm here to talk to you a little bit about the training programs themselves as well as the career prospects. I'm going to talk to you about not only the prospects of working in each industry, but a little bit about what we train in the program as well as some other services that we provide. So of course, you know, what's one of the reasons why you want to take an online training program is you get all the flexibility in the world. You get to work from home, you get to go at your own pace. And ultimately, once you complete the program, hopefully you can find a better job and start to earn a higher living. One of the things that we help you with here at CareerStep is we do a job placement, and we help with not only identifying employers, but also notifying you of job opportunities in your area, as well as resume reviews, interview coaching, best practices, things of that nature. We do that for all of our programs, and I'll talk to you a little bit more specifically when we get to the slides about each program, but that is something that each one of our students gets. One of the unique things about our training program when you compare it to anyone else, not only in the online training industry, but even on campus at various community colleges or other continuing education areas throughout the country, is all of our training is industry focused. We get a lot of our materials directly from the employers that hire our graduates. Everything that we train you on is relevant to your day-to-day operations as an employee, and we want to make sure that you're given all the tools needed to do your job successfully. So there's a ton of collaboration that goes on with employers and CareerStep to develop these programs. And like I said, the biggest thing for us is making sure that we're training you how to do your job. It's not just about passing or failing a class or passing a certification exam. It's about can you work, can you effectively do your job, and are you a gainful employee to be? And that leads us right into our next slide. I mean, this is truly how we believe our students at CareerStep. Your success is our success. We rely heavily on the successes of our past students to help continue to grow relationships with employers in the industry. We have a lot of employers that come back and request CareerStep graduates, and we couldn't do this without the success of our students. Each industry is going to be a little bit different as far as what sort of relationships we have, but just as an example, in our medical transcription editor program, we have over 158 employers that we work with on a continual basis to hire our graduates. And they literally will email our graduate services team on a monthly basis and just ask for the most recent graduates so they can go through the interviewing and hopefully job offer process. So again, we couldn't do it without the success of our students. We've been doing this since 1992, so there are plenty of great relationships that we've made throughout the years, but again, we couldn't have done it without the students' success. The first program I'm going to talk to you guys about is the medical transcription and editing program. Basically, what a medical transcriptionist does is they put the pen to the paper once the doctor operates or has a procedure on a patient. So you go to the doctor, let's say you have knee surgery done, the doctor performs the surgery, and after he's done, he'll speak into a recording device and he'll describe what he went through in the operating procedure. Maybe he'll put the diagnosis for recovery. If there's medication that he prescribes, whatever's going on with the procedure, he'll record into a dictating device, and then it's your job as a transcriptionist and or editor to either type that report verbatim as the doctor described it, or to edit maybe what a speech recognition technology software system has typed for you. So basically, there's two ways that you do your job. One, typing, the other, editing. There's two different options in terms of the training program. There is one training program that will teach you exclusively how to transcribe and not to edit. And then the other one, which is our most popular program, is the medical transcription and editing. It teaches you both skill sets. So you're employable by both companies that hire transcriptionists or editors. So that one is by far the most popular program. We have over a 91% graduate employment rate in that program. The average salary is $34,000 a year. The typical transcriptionist works about 27 hours per week. So you can kind of skew that number, that salary number, based off of how many hours you are available. This is one of the most flexible professions in the world. 90% of our students work from home. So a lot of times they'll work for an employer that doesn't even live in their same state. So it's a total virtual workspace. The only thing that's required to be a transcriptionist is A, the skill set that's necessary, and then B, a secured internet connection. So you could be, there in New York, your employer might be based in Miami, Florida, and you may actually be doing transcription work for a hospital in Phoenix, Arizona. So it's a completely virtual workspace, not a whole lot of job opportunities on site. Most of these are done through medical transcription service organizations. But it's important to note that our program is AUDI approved. AUDI stands for the Association of Healthcare Documentation Integrity. It's basically the governing body of the transcription world. So anything that happens in the transcription industry kind of goes through AUDI, and there's a number of local chapters of AUDI that you're more than welcome to join once you complete our program. And in fact, you get an AUDI membership with the program itself. So when you register and you enroll in the program, you'll get AUDI membership too. So I think that AUDI membership is 14 months, or actually I think it's 15 months. And then after that 15 month is expired, you can continue on. I think they charge an annual fee to be a member, or a lot of employers will have you join that membership as part of your employment terms. But the program itself is available 24 hours a day, 7 days a week, and this is, again, for all of our programs. They're all self-paced, so there's an instructor that's there to support you. They're just not leading the discussion. So you're going at your own pace. Any questions that you have, you contact our student support. They're available Monday through Friday, 10 to 7 Eastern Time. Any questions you have about the course material, or if you just need a better understanding of anything, you can call them and talk to a live person. If it's ever after hours, you're more than welcome to send them an email. Let them know what time works best for a phone call back. That way you're available to talk to them as well. All the materials that you need come with the program. You're going to get 10 textbooks. You're going to get the transcription foot pedal that plugs into your USB port on your computer, and this keeps your hands and your hands free to transcribe. So instead of starting and stopping the recording with your hands, you can use your foot pedal, which comes with a software download program. So it just kind of teaches you to be more efficient and effective in the transcription world. You'll also get the membership to AUDI, as I mentioned earlier, and then you'll get a 15th month subscription to Benchmark KB. And that's an online database that the transcription world uses to look up, operations, terminology, definitions, et cetera, et cetera. If there's any questions you have about a report, you can find it using that Benchmark KB. And so you get access to that too as part of our training program. Once you complete the program, you take the final exam, pass the final exam with an 85% or higher, and then you're moved on to our graduate services team. The graduate services team then helps you find a job. So what they're going to do in this program is they're going to ask you what you're looking for in an employer. Do you want to work full-time, or do you want to work part-time? If you want to work part-time, do you have certain hours you can commit to, or do you need the flexibility to simply work when you're free and you can't commit to when you're going to be free? All of these questions they're going to find out from you, and then once they get those answers, they're going to let you know what companies to apply for. We have companies that we work with that hire our graduates to be full-time employees Monday through Friday, work 8 hours a day, get full-time benefits, you get sick leave, you get vacation, you get all of that stuff. And then we have other companies that hire our graduates as independent contractors, where you simply log on to the company's intranet, you download a report, upload the report when you're done working on it, and you get paid for each report that you do. There's no minimum requirements to work for them. You can go months without doing a report, or you can do 10 a day. It's completely up to you. So again, that's something we're going to help you with, and we're going to find out what it is that you need in an employer, and we'll try to match you as best that we can. So that is the transcription and editing program. It's the cost of the tuition is $2,580. It's 640 hours long is the length of the program. So it typically takes our students 4 to 12 months to complete the program. Obviously, the more time you have to spend working on the program, the quicker you'll get it done. If you can never get it done within that full year, you can purchase extensions. The extensions are done in 4-month periods. So if you're ever running out of time and you don't think you're going to get it done, it's best to purchase an extension as opposed to letting the program expire. Because once you do let the program expire, you would have to re-enroll and pay basically full price for the entire tuition. So, but I'll give you guys a website to go to as well once we get done here. It's basically the website's careerstep.com/hofstra, and on that website there are a number of video tutorials as well as program brochures, and the program brochures will break down by hours how long each one of these programs should take and what is studied in those in each module as well. So. Okay, our next program we're going to talk about is a medical coding and billing program, and this is by far and away our most popular program right now. I'm not sure if you're aware or not, but right now within the coding industry there's a huge transition going on. They are transitioning from ICD-9 codes to ICD-10 codes, which will be done in October of 2014. So basically, the U.S. is the last nation to use ICD-9 codes. Everyone else is using these ICD-10 codes. The only difference is they use ICD-10 for classification and research purposes. We're going to use ICD-10 for reimbursement purposes. So we're the first nation to undertake this in our healthcare settings, and it's provided quite the challenge to the industry. Initially, this transition was supposed to take place in October of 2013. They pushed that back an additional year because the healthcare industry was not ready for it. But what you're seeing is right now, ICD-9, you have anywhere from 14 to 17,000 codes. That's the number of codes that are available based on whatever procedure is done to a patient. Well, in October of 2014, when the ICD-10 transition takes place, there's going to be over 77,000 codes. So it is growing exponentially, and the code sets themselves are going to be a heck of a lot more specific than they've ever been. So what does that mean to the industry? Well, it means everybody working as a coder right now is going to need to learn this new coding language, the new ICD-10, and so that's going to open up a lot of job opportunities for new coders because you're on the same playing field really as any coder that's been in the industry. They've never used ICD-10 codes because they've never been required to. They've always used the ICD-9 codes, so they need to use and learn ICD-10 just like anyone entering the industry. And so what hospitals are starting to experience is they're quickly realizing that their current staff, a lot of them aren't going to continue on as a coder. They don't want to learn the new skill set. They don't want to take the time and or energy to learn the ICD-10, so it opens up job opportunities for new folks entering the business. Also, what hospitals are realizing is they need a much larger staff to handle these new code sets. Since the codes are quite a bit more specific and are longer per procedure, it's taken longer to code the ICD-10 codes. So it's important that the hospitals are prepared for this to keep their reimbursement timelines on track. So you're going to see a lot more jobs start to open up in the summer of 2014. A lot of these healthcare facilities are going to do dual coding where they're going to continue to use ICD-9 so they get reimbursed properly up until the deadline, but they're going to also want to use ICD-10 so they can prepare themselves for the industry changes and make sure that they're prepared for what's going to take place in October of 2014. So, that being said, no better time than now to take this training program. It's 4 to 12 months in length. The program itself is 565 hours. So again, the more time that you have available to spend on the program, the quicker you can get through it. But it's important to know that this training program is AHIMA approved and endorsed. AHIMA is the American Health Information Management Association. They are one of the certifying bodies that you must pass certification with to work in the industry. They're very particular. They're very picky about who they approve, what training providers get their stamp of approval and endorsement. And CareerStep is the only exclusively online training provider with that stamp of approval. Basically what that means is if you go to AHIMA's website, it's ahima.org, and you do a search for approved training providers, do it by state, and you can look in each state, what schools are approved. But one of the things that's interesting to us, at least, is when you look at approved training providers and you compare the cost of their programs along with the length of time it takes to complete their program. A lot of times it takes up to 2 years to complete the other programs, and oftentimes it's 5 to 10 times more expensive than our training program is. So really, our program is about as great of a value as you can get entering the coding industry that's out there, and that's coming straight from AHIMA. So again, don't take my word for it. Go look on AHIMA's website. It's ahima.org. Make sure you search for approved training providers by state. Look in the state in which you live, and then write down some schools. Look and see. Go to the school websites. Look and see how long it takes to take the programs, what it costs, and then go to Utah and search under approved training providers in Utah, because that's where our company is based out of. You'll see CareerStep, and you'll see obviously our cost is $24.70, and the length of time, 4 to 12 months at your own pace. The beauty of that is, you're still going to enroll in the program with Hofstra, and you're going to be a Hofstra student. You're just going to be a Hofstra student taking the CareerStep program. So you kind of get the best of both worlds. You get the Hofstra name there locally, which is obviously recognized, and then nationally you get to take this AHIMA approved training program that obviously Hofstra couldn't offer you unless they partnered with an organization like ours. So it's just an overall great program to take. The starting salary is $40,000 a year. Where else can you start off at $40,000 a year with less than a year's worth of training? There's no degree required. It's that certification. Once you complete our final exam, you'll sit for the national certification through AHIMA, pass that, and then you're work ready. And at that point, the longer that you're in the industry, the more certifications you can pass and sit for, the higher earning potential you will have. The job market entering, as I mentioned earlier, 21% job growth through 2020. Everyone that we talk to, all of the conferences that we go to, a number of the trade organizations that we belong to, they feel that is actually a low number, that number is going to be higher as IC10 continues to evolve and the industry kind of shakes out those that are going to leave. It's just a really good time to look at a career as a coder. So it's important to notice that this is a medical coding and billing program, so you're more than capable of working in the billing department at an organization. However, it's important to know that the medical coders typically earn more than the medical billers. But again, after taking this program, you can work in either arenas. Okay, so our next program is Pharmacy Technician. This is a fairly self-explanatory program. It's one of our shorter-term programs. It's only 285 hours long, so you can get down in as little as 3 to 6 months. Average salary for a pharmacy technician, $30,000 a year. Our graduate employment rate's at 76% right now. The job market expected to grow over 30% through 2020. Basically, what you're seeing is a lot of the 24 hours a day, 7 days a week pharmacies that are out there obviously need to staff up to handle the demands of those hours. So job opportunities are certainly going to be there. Our program's only $1,900, and one of the nice things about what we do at CareerStep, and it kind of goes into our namesake CareerStep, but we provide externships with either Walgreens or CVS for you. So what we're going to do when you're in the program is we're going to find out where it is you live, if you live closer to Walgreens or CVS, what hours you're available to work, and how far of a commute are you willing to do, what's your availability for this externship, and then we'll place you in the appropriate externship. So that will either be with Walgreens or CVS. We handle everything as far as that's concerned, and it's really great because you get to work in the pharmacy. You're going to be filling prescriptions. You're going to be working as a pharmacy technician. Obviously, since it's an externship, you're not going to be paid, but you can use it as a trial by fire type deal where you're doing some hands-on training, and hopefully after your externship is complete, worst case scenario, either Walgreens or CVS offers you a job opportunity. Or obviously if you want to look at other pharmacies to work at, typically the hospitals pay a bit more than the retail pharmacies do. Again, it's just going to really depend on who's hiring, if you're working in the retail setting or kind of the hospital setting. But generally our employees or our graduates that become employees tell us that their earning potential seems to be better working at the hospitals if you can get that job. So All right, so our next program that we're going to talk about is Medical Administrative Assistant. So this program, again, is one of our shorter-term programs. It's only 3 to 6 months to complete. Average salary is $32,000 per year in this industry. Cost of the program is only $13.25, so it is definitely one of our least expensive programs. It is national. It's approved by the NHA, the National Health Career Association. So once you complete our training program, you'll sit for the CMAA, the Certified Medical Administrative Assistant, and once you pass that certification, you are work ready. The program itself is only 200 hours long. Job market's supposed to grow by 4 to 1% through 2020. Again, a very strong job market. Graduate employment rate that our students are reporting back is at 69%. Again, it's going to depend on your specific situation, but just keep in mind that if you do take this program and there aren't a lot of medical administrative assistant jobs in your area, you're more than welcome to apply for other executive assistant jobs because you're more than qualified to do those functions as well. You're going to learn everything about the Microsoft Office suite that you'll need to know in order to work at the front desk and to run an office. So again, it just, you're not just limited to the healthcare world. You can do other things as well. The nice thing about learning about the healthcare world, you're going to learn about the medical law and ethics and the HIPAA guidelines and the things that are important to working in a healthcare facility. But again, you can do other things as well. So once again, kind of follows along the same theme of our training program and whatnot. It's flexibility. It's doing what's right for you and finding the right situation for you. But as I mentioned with all of our programs, our graduate services team is going to be there to walk you through everything, and they're going to make sure that you get, you're putting your best foot forward in terms of looking for employment. Each program, you're going to get resume review and interview coaching. So there's a lot of skills that maybe you had at previous jobs that transfer over, and it's going to be important to speak about during your interview process. And so our graduate services team is really good about letting you know what to say, when to say it, what the HR directors are looking for at each healthcare facility or at each employer. I mean, we're dealing with these folks on a daily basis, and so we know what it is that they're looking for. And we really do a good job of pushing that along to our students. You get the graduate services for up to a year after you complete all of our programs. So obviously we don't want it to take you a year to find a job, but if you do find a job right away and you end up not liking that job, maybe you don't get along with your boss, or the pay wasn't what you thought it was, or maybe the commute is just too much, by all means you can keep using our graduate services team beyond just finding that first job. You have access to them for a year. You're going to have the same graduate services advisor from the day you complete the program, so you'll have a one-on-one relationship with that person, and you'll be able to reach out and use them as often as you would like. But basically, the next steps and what to do once you know what program you want to enroll in, you're going to go through the registration process directly with Hofstra. Once you complete your registration and pay the tuition, you're going to receive an email from CareerStep with your username and password. That username and password is going to be get there within 24 hours of us receiving your registration information from Hofstra. We're going to also reach out to you and schedule a one-on-one kind of orientation for your program. We want to make sure you understand all of the services that are available to you as a CareerStep and Hofstra student. We want to make sure that you understand how to navigate the website, that you understand all of the tools that are available to you on the website, and make sure that you basically heard everything that we want you to hear live and in person over the phone. Once you completed that orientation, you should receive your materials within 7 to 10 business days, typically. Each course is a little bit different in terms of the materials that you receive. For example, the medical coding and billing program, you're going to get the code books that you're going to use to do your code work, but you're not going to get those until you need them. So you need them in the second half of the program. The reason why we wait to send them out when you need them is because the codes continually change and they get updated on an annual basis, and we want to make sure that you're using the most recent code books. So it doesn't make sense to send you code books today if you're not going to use them until February, and if in February they've changed codes or updated a few things, we want to make sure that you have the most recent information. Also want to let you guys know that we are running a promotion currently with Hofstra, and all of our academic partners for that matter. If you enroll in either the medical coding and billing program or the medical transcription editor program, you can elect to receive either a laptop or a $325 discount off of tuition as a promotion, and that's good through October 31st. If you enroll in pharmacy technician or medical administrative assistant, you can elect to receive $200 off of tuition or a Kindle Fire as your materials. So that is good through October 31st. But I want to show you guys the website really quick too that I suggested you guys go to. It is careerstep.com, and then /Hofstra. So on this website, you can learn a little bit more about the programs. If you just look over here at this tab, Our Programs, click on the one that you're most interested in, and you can go and download a brochure. So obviously, you'll learn some key things that we've kind of already talked about a little bit here. But then also you can download the brochure. And the brochure is going to, cover everything from what you're going to do in the office, how much you're going to earn, what the job market looks like, and then here is the breakdown of the modules spent, the time spent in each module. So you'll see this one is 565 hours long. If you go back to the main page here, you can take a video tour. So you go to the video tour, and there's a number of testimonials. So you can hear from our CEO, our student support personnel. There's student reviews. Obviously, those are always important. There's one for each one of the programs, and then you can take a tour of the courses as well. So there's the medical transcription and editing course tour, the pharmacy technician course tour. There's webinars. So if you want to maybe just attend or listen to a specific webinar about a specific program, those are available right there. Graduate support, again, if you want to hear kind of what they do on the daily basis, what they look for when they interact with the students, et cetera, that's all there for you to check out on that website. So again, it's careerstep.com /Hofstra. Again, there's the tuition tab. It'll show you how much each one of the programs cost to enroll in. If you want to link back to Hofstra's continuing education website, there's that link to do that as well. And again, it's important to note that you'll be enrolling in the program with Hofstra. Again, I can't stress enough the importance of being both the Hofstra student and the Career Step student. Again, make sure that when you do enroll, it is directly with Hofstra, because otherwise, if you were to enroll directly with Career Step, you wouldn't have that local, field. No one would know that you're that you found out about the program from Hofstra. So you enroll through Hofstra, you get to be the best of both. You get to be a Career Step student and a Hofstra student. So, but I think we're going to try and open this up to questions. The way the webinar is set up is that I believe you'll ask Debbie the question and she'll communicate those to me. Am I understanding that correct,
yes,
Debbie?
you can. If you have a question, you can type it in on the right side of your screen, and we'll try to answer it. And maybe you can talk a little bit, Tommy, about the explosion of the healthcare industry and why there are going to be so many jobs available in the future.
Sure. Obviously the two most popular programs that we offer right now, and kind of where we're seeing this explosive growth, the medical coding and billing, just the change in that industry is really driving that explosion. It just is something that's going to be completely different than it's ever been, and the whole industry as a whole is needing to adapt to these changes. And so it means new opportunity for everyone, not only currently in that industry, but entering the industry. It's something that we've never seen. The medical transcription and editing program, same thing. That industry has really changed and transformed for what it used to be. It's funny, if you go to a local hospital, or if you go to a doctor's office, or maybe someone that used to work in the transcription industry, and you ask them, hey, are there any transcription jobs? Is this a good field to enter into? And probably 95 out of 100 people you talk to will say, no, we don't even have transcriptionists at our facilities. We haven't used transcriptionists in years. Or the doctor might tell you, I don't need a transcriptionist. I do these reports myself. I have a laptop I take into my meeting room with my patient, and I produce their electronic medical record right then and there. And they are right. Those are the folks that aren't using transcriptionists. But the people that are using transcriptionists are these medical transcription service organizations, and these are the folks that are contracting with hospitals on a national and regional basis. So as far as the local hospital is concerned, they might tell you we don't have a transcription department. And the reason they don't have a transcription department is because they have actually contracted that work out to somebody else, and that's the medical transcription service organization. So it seems like that industry is one of the most unknown kind of underworld markets that's out there, because people just don't realize the amount of growth and job opportunity that there is. But we literally get more requests each month from employers asking for new students than we have new students completing that program. So it's one of those things where healthcare, obviously, it's here to stay. People get sick. New babies are born every day. People pass away every day. The healthcare facilities are in constant use, and as we continue to grow into age, the need for healthcare facilities and healthcare professionals are going to continue to grow. So fortunately for those in the industry, that's a good thing. As life happens, so to speak, the need for healthcare is going to always be there. So there really isn't a more stable industry to jump into.
All right. Well, I guess, Tommy, that you were so clear in your presentation that we don't have any questions. So we're going to end it here. We are recording this. It will be available on our website within the next 24 hours. So if you have any questions, you want to review this again, you'll be able to do that. Thank you so much for joining us. Tommy, thank you so much for presenting, and hope to see you online. Bye-bye.
Thanks, Debbie. Bye-bye.